It's Dr. Bowling at Southeastern Plastic Surgery, and I'm coming to you today to talk about breast diameter. It's one of the most important measurements when we as plastic surgeons are determining breast implant sizes for you, the patient. I want to show you how I do that. I want to show you how you can do that at home if you want to figure out what your breast diameter is. Obviously, there's a lot of other things that go into choosing breast implants. There's a lot of videos out there that go over that pretty well, whether it be implant style, shape, silicone, saline, textured, smooth, high profile, ultra high profile, moderate profile, all that stuff. It can get very confusing, but the starting point for everything is diameter. So here's my mannequin, and obviously we're going to show you how I determine breast diameter, how breast diameter is determined by almost all plastic surgeons, and how you can do this at home. So breast diameter is the footprint of the breast, which means it starts here where the breast starts to curve. So breastbone curvature up and down line here is where the breast diameter, not on the breastbone, it's where that curve starts. That's the middle portion, and then you have a lateral portion. Where's the lateral breast end? Basically wherever it curves out just slightly lateral to your rib cage and chest wall. So we're going to measure here to here as straight lines out. Again, you're not measuring this curvature, you're not measuring around over like this, like you would be trying to measure a cup size. Has nothing to do with cup size. This is a diameter. So the plastic surgeon is going to take his tape measure. It's going to imagine a straight line coming out from your chest where your breast starts and where your breast ends, and he's going to visually look at that on his tape measure, and he's going to measure, or she's going to measure, and I get 10.5 centimeters. So I'm going to use that 10.5 centimeters for my assistant to write down, and then I'll choose multiple projections and styles of implants for you as a patient to try on based upon that diameter. So if you want to do this at home, how do you do it? You can try the technique where you take a tape measure or a ruler and you try to visualize this. It's a little hard if you haven't done it hundreds of times, so the easiest way to do it is with a caliper. Some plastic surgeons use calipers. I don't. I use the other technique, but again, this is a very easy way to do it. Get you a caliper from Lowe's, Home Depot, Amazon, and it just is a slide. It slides back and forth, and you may have used one of these in school at some point. And it's got numbers on it. This one actually has a digital readout that will tell you exactly the number. And we want to do this in centimeters. So get your caliper. Again, know that breast starts where it starts to curve at the breastbone and then goes to right beside your chest wall where the breast starts to curve on your rib cage. So I'm going to measure a point from here to here. Imagine a vertical line coming out. So take this, put it right where the breast starts. I'm going to take this slide, and I'm going to slide it till it hits the side of the breast, and then I'm going to look at my number, and I'm at 10.5. So again, that 10.5 is going to be used to determine the different sizes for your breast diameter. So hope that helps.